I'm your host, Neal Howard, here on Health Professional Radio. Thank you for tuning in today. Our guest is returning to speak with us, Dr. Sylvia Morris. She's an Atlanta-based internist, and she's here to talk about the importance of civility in healthcare. Now, she kind of introduced the topic in a recent U.S. News and World Report piece, but there's still a lot to explore as this issue seems to be, well, kind of a concern for many folks, from politics to sports to education and healthcare. Welcome back to Health Professional Radio, Dr. Sylvia Morris. Glad to talk with you again.
Thank you very much. It's great to be with you and your listeners.
Great. Now, as far as civility, we're all pretty much familiar with the term, but when it relates to healthcare, aren't you doctors just civil by nature?
Wouldn't that be lovely? I think what we have to remember is that doctors are people too. Mm-hmm. And sometimes we have good days and bad days. And what we do is really predicated on having relationships with people. So whether it's with the nurses, with our other colleagues, and certainly foremost with the patients.
You know, when I said, aren't you civil by nature, many of us kind of assume that since you're a doctor, you know, you operate under the Hippocratic Oath, you're here to heal. So what type of behavior other than civil behavior would you display as a doctor? But apparently it's an issue. So why don't you tell us first what civility is as it relates to healthcare?
Yeah, I'm glad you asked that question. I think when we talk about the Hippocratic Oath, the first things I think that most people think about is doing no harm. And that's true. But there are also some other things that are also embedded in the modern Hippocratic Oath. So when we talk about I will not be ashamed of saying that I don't know, and then certainly being able to share knowledge. So those two concepts, we really need civility in order to make those things work. And really the bottom line is, how do I get the best care for my patients? So yes, civility on the surface should be sort of automatic behavior, but we definitely have examples in popular culture where we're seeing that things are not quite as civil as they ought to be.
From the patient standpoint, is civility relative?
Well, certainly, it depends upon your perspective. So depending upon maybe how old you are, so if you see, let's say, a doctor who has their back to you and taking notes when they're doing the exam, or they're looking at the computer screen as opposed to looking directly at the patient, some people may see that as uncivil behavior, whereas we know that may be part and parcel on how we now collect and document information. But I think that there are certain things that we can all agree are uncivil. So whether we are rude to each other, or we are dismissive, or, we have more aggressive communication styles.
What do you think about the concept of patients maybe not having such a preconceived notion of the civility of a healthcare provider, where you put someone in a higher level of esteem than yourself because of their profession? I guess civility can work both ways, not necessarily the patient being uncivil, but being able to recognize some of the things that, we find normal that may not be uncivil, to us at first. Maybe looking for certain things, like you say, turning your back while you're taking notes. Well, maybe, you're the doctor. You've got better things to do than look at me. Maybe not looking at it like that.
Yes. I think that what we really want to do is try and kind of make the optimal environment in which to, diagnose and treat a patient. Sometimes patients, they come in with particular expectations. So they've been online, or they've been reading, they've talked to their cousin or their brother or sister who happens to be a healthcare professional, mm-hmm. or somehow peripherally related with healthcare. And then they have particular ideas on how they wish for their care to go. And depending upon the relationship between the physician and the patient, and how that patient then communicates that information or that question, sometimes that can be a little bit of a sticking point. So then perhaps the patient is unhappy because they didn't get what they thought that they ought to have received?
We talk quite a bit here on Health Professional Radio about some of the training that our healthcare providers don't get when they're in med school. Sometimes nutrition, things of that nature. Is bedside manners something that isn't really addressed when you're, on that med school journey and discovering how you are going to practice medicine?
No, I think, over the years, having true communication classes or that being integral to medical education has really kind of come a long way, and not only talking with each other, our colleagues, but also with other ancillary staff as well as the nurses. So that training is also modeled by kind of what we call attendings or higher level physicians. So when you're a first or second year medical student, you may be in an outpatient office setting with an attending physician, and then you do a physical diagnosis or you talk to the patients about what's going on with them, and then you shadow a physician. So then you're able to see, appropriate ways in which to speak to patients in particular settings. And then as we continue our journey through medical school, we have more interactions with patients. And then depending upon where you go to school, some med schools videotape you. Some people have modules that are dedicated to communication, and they really sort of critique you and give you feedback. So I think that certainly over the last several years, people have really improved and have thought about what we kind of classically call the bedside manner, but also to remember that just because we see one, do one, teach one, there is always room to sort of tweak how we are interacting with people, both patients as well as colleagues.
In your opinion and in your experience, how does the nature or the severity of a person's medical condition or situation impact the civility with which a physician deals with the patient?
Yeah, that's a really great question, because the sicker the patient, the more important that time is. So let's say we're in the intensive care unit as an example, and the patient is not doing well. Then not as to say that it is acceptable to be rude and abrupt, but there are points in time where you have to be very succinct and very directed with people around you, so that we continue to focus on the care of the patient and that we don't miss opportunities. So you're very right. When we have time, I don't want to say it's easier to be civil when we have more time, but it also becomes important that those relationships you have with the other nurses, the other ancillary staff, the fellows, all of those other people that create the team for medicine, that you're aware and conscious of being civil under sort of normal circumstances, so that in the event that something happens where you're a little less civil than you would normally be, then that kind of gives you some wiggle room, and it doesn't really destroy the relationship.
What would you say to the patient who's experiencing a very serious, possibly life-threatening condition, and they feel that the person that can help them the most is being a little bit cold or less than civil in their opinion? What do you say to this patient when it comes to maybe finding someone else to deal with their situation, or staying with someone who's, very versed in their area of expertise?
Right. That's always very tricky because certainly we always want the best care, but not every physician is ideal for every patient. As much as I'd like to think that I'm the perfect doctor for every patient, that's honestly not the case. But if you have a particular disease that is very narrow, very specialized, very rare, then there are fewer doctors who have a certain amount of expertise in that particular area, then that may not give you as much wiggle room to say, I'm going to go to the next doctor. The other thing to remember is that when you're sick, time is really important. So if you want to leave one doctor to go to another doctor, remember there's going to be a delay in you receiving the appropriate care.
Absolutely.
And then the final thing that I would leave patients with is to think about as simply as this. Is there someone else who can go with you who may be able to better communicate with that physician, or who may be able to see the interaction and help you think about it more clearer? But I'm never going to say that categorically you must stay with a physician that you don't vibe with, that you don't think is doing a great job, because certainly that is not the case.
Well, Dr. Morris, always a pleasure, always informative. Thank you so much for coming back and talking with us today. Hoping that you'll come back and speak with us again soon.
I look forward to it. Thank you very much.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Sylvia Morris, Atlanta-based internist, talking about the importance of civility in healthcare. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page when you visit our platform at hpr.fm.